Hello everyone and welcome back to the channel. Today, we're diving into an important topic that affects millions of people worldwide. Specifically, we'll be discussing 10 nighttime signs that could indicate your blood sugar is out of control. Have you ever found yourself waking up in the middle of the night, drenched in sweat? Or perhaps you constantly feel thirsty no matter how much water you drink? These could be more than just minor inconveniences. They might be warning signs that your blood sugar is out of control. Blood sugar fluctuations can be subtle, but at night, they can manifest in ways you might not expect. Ignoring these signs can lead to long-term complications like diabetes, nerve damage, and even heart disease. But don't worry, we're here to help you recognize these symptoms early. If you're concerned about your health, or just want to learn more, stick around because this video is packed with valuable information. So let's get started. Before we jump into the signs, let's quickly review what blood sugar is and why it matters. Simply put, blood sugar refers to the amount of glucose circulating in your bloodstream. Glucose, which comes from the food we eat, serves as fuel for our bodies. Insulin, a hormone produced by the pancreas, helps move glucose from the bloodstream into our cells, where it can be used for energy. However, when insulin isn't functioning properly, or if there's too much glucose in the system, it leads to high or low blood sugar levels. Over time, these imbalances can lead to serious health issues like diabetes, cardiovascular disease, and kidney damage. According to the American Diabetes Association, nearly 37 million Americans have diabetes, and another 96 million adults have prediabetes, a condition where blood sugar levels are higher than normal, but not yet diabetic. Maintaining stable blood sugar levels is crucial for preventing conditions like type 2 diabetes, heart disease, and even kidney damage. And while many symptoms of uncontrolled blood sugar occur during the day, there are also several subtle and sometimes alarming signs that show up at night. For most adults, a fasting blood sugar level below 100 milligrams per deciliter is considered normal. Levels between 100 to 125 milligrams per deciliter suggest prediabetes, while anything above 126 milligrams per deciliter after 2 tests may indicate diabetes. Now let's explore how these fluctuations can manifest during the night. Our first sign is frequent urination, also known as nocturia. It is one of the most common signs of high blood sugar level. If you find yourself getting up multiple times to urinate during the night, it could be a sign of hyperglycemia, or elevated blood sugar levels. When blood sugar levels rise, your kidneys work overtime to filter and absorb the excess glucose. If they can't keep up, the glucose ends up in your urine, pulling fluids from your tissues and making you urinate more often. A study published in Diabetologia found that individuals with poorly controlled diabetes were significantly more likely to experience nocturia compared to those with stable blood sugar levels. So if you're consistently losing sleep due to bathroom breaks, consider speaking with your healthcare provider. Another classic symptom of high blood sugar is excessive thirst, medically referred to as polydipsia. As your body tries to flush out extra glucose through urine, it pulls water from tissues, leaving you dehydrated and thirsty. As a result, you may wake up parched or feel compelled to drink large amounts of water even after going to sleep. A study in the Diabetes Care Journal explains that this cycle of thirst and urination is a classic symptom of hyperglycemia. Moreover, another research published in the Journal of Endocrine Connections highlights polydipsia as one of the earliest warning signs of diabetes mellitus. Staying hydrated is crucial, but persistent thirst despite adequate water consumption should prompt further investigation. Night sweats are another telltale sign of erratic blood sugar levels. If you experience excessive sweating, particularly around your neck and chest, your blood sugar levels might be fluctuating during sleep. When your blood sugar drops too low, a condition known as nocturnal hypoglycemia, your body releases stress hormones like adrenaline to raise it back up. This hormonal surge can cause sweating, even in a cool room. According to the American Diabetes Association, nocturnal hypoglycemia is a significant concern for people taking insulin or certain diabetes medications. Moreover, the New England Journal of Medicine reports that night sweats are particularly prevalent among people using insulin therapy. If you're experiencing night sweats regularly, it's essential to monitor your blood sugar levels before bed and discuss this with your healthcare provider. Unstable blood sugar levels can also significantly impact your sleep quality. A study in the Journal of Diabetes Care found that individuals with uncontrolled blood sugar often experience fragmented sleep, frequent awakenings, and difficulty falling back asleep. High blood sugar can cause discomfort, thirst, and frequent urination, all of which can disrupt your sleep. On the flip side, low blood sugar can trigger anxiety, nightmares, or even wake you up abruptly. A study in Sleep Medicine Reviews 2019 found that people with diabetes are more likely to experience sleep disturbances, and poor blood sugar control is a major contributing factor. Sleep is essential for your body's ability to regulate metabolism and repair cells. Chronic sleep deprivation due to blood sugar issues can increase stress levels and worsen insulin resistance, making blood sugar control even more difficult. If you're tossing and turning more often at night, your blood sugar levels could be playing a role, and you should consider discussing with your healthcare provider. Have you ever woken up from a terrifying nightmare only to find yourself drenched in sweat? Blood sugar fluctuations can influence brain activity during REM sleep, leading to intense dreams or nightmares. A review in Sleep Medicine Reviews suggests that blood sugar imbalances can contribute to night terrors and emotional disturbances during sleep. Your brain relies on a steady supply of glucose to function properly during sleep cycles. When glucose levels fluctuate too much, it can lead to abnormal neural activity, causing vivid and sometimes distressing dreams. If nightmares are a regular occurrence, monitoring your blood sugar levels and considering adjustments in your evening meals may help. Blurred vision is yet another red flag for high blood sugar. Elevated glucose levels draw fluid away from the lenses of your eyes, affecting their ability to focus properly. Although temporary, this symptom can interfere with reading or watching TV at night. According to the British Journal of Ophthalmology, prolonged exposure to high blood sugar increases the risk of diabetic retinopathy, a condition that damages the blood vessels in the retina. Diabetic retinopathy is one of the leading causes of blindness in adults and often develops silently, without noticeable symptoms in its early stages. If you notice blurred vision occurring frequently or worsening over time, don't ignore it. Schedule an appointment with your eye doctor for a comprehensive exam. Early detection and treatment can prevent irreversible damage and preserve your vision. Another sign of an erratic blood sugar is tingling or numbness feeling in the hands and feet. If you frequently experience tingling, burning, or numbness in your hands and feet at night, it could be a sign of diabetic neuropathy. According to research in The Lancet Neurology, prolonged high blood sugar can damage nerves over time, leading to discomfort that often worsens at night. Neuropathy is a serious complication of diabetes and can cause not only pain, but also loss of sensation in affected areas. If untreated, this condition may increase the risk of infections and wounds that don't heal properly. Maintaining blood sugar levels within a healthy range is essential to prevent or slow down the progression of nerve damage. Unstable blood sugar level can also slow down the healing of wounds. Poor circulation and reduced immune function resulting from uncontrolled blood sugar levels can delay recovery. Even minor injuries may take days or weeks longer to heal. The Wound Repair and Regeneration Journal highlights that diabetic patients face higher risks of infection and impaired wound healing. High blood sugar damages blood vessels, restricting oxygen and nutrient delivery to injured tissues. It also weakens the immune system, making it harder for your body to fight off bacteria and promote healing. If you have diabetes, it's crucial to inspect your skin daily for signs of injury, especially on your feet. Prompt treatment of wounds, combined with meticulous blood sugar control, can significantly improve outcomes. Keeping your blood sugar within target ranges supports faster and healthier tissue repair, reducing the risk of complications like ulcers or infections. Do you wake up feeling exhausted even after getting a full night's sleep? This could be due to unstable blood sugar levels. When blood sugar is too high, your body struggles to properly utilize glucose for energy, leading to fatigue. On the other hand, if blood sugar drops too low overnight, it can also cause fatigue because your cells aren't getting enough fuel to maintain normal bodily functions. A study in diabetes research and clinical practice found that individuals with poorly controlled blood sugar often report feeling fatigued, regardless of how much sleep they get. A study in The Lancet Diabetes and Endocrinology 2020 also emphasizes that fatigue is a common symptom of poorly managed diabetes and can significantly impact your quality of life. If you're constantly tired, it's time to take a closer look at your blood sugar levels. Keeping glucose levels stable through proper diet and lifestyle habits can help combat this issue. Lastly, snoring and sleep apnea deserve mention. Obstructive sleep apnea, OSA, is strongly associated with insulin resistance and metabolic syndrome. In fact, studies in Chest magazine show that up to 80% of people with type 2 diabetes also suffer from OSA. Sleep apnea involves repeated pauses in breathing during sleep, often accompanied by loud snoring. These interruptions prevent deep, restorative sleep and contribute to daytime fatigue, cognitive impairment, and cardiovascular problems. Moreover, The intermittent oxygen deprivation experienced during apneic episodes exacerbates insulin resistance, creating a feedback loop that worsens both conditions. Treating sleep apnea through lifestyle modifications or devices like CPAP machines can improve both sleep quality and blood sugar control. Losing weight, avoiding alcohol before bed, and sleeping on your side are simple steps you can take to alleviate symptoms. In more severe cases, continuous positive airway pressure therapy may be necessary to ensure uninterrupted breathing throughout the night. There you have it. 10 nighttime signs that your blood sugar might be out of control. If you're experiencing any of these symptoms, don't ignore them. Talk to your healthcare provider and get your blood sugar levels checked. Remember, early intervention is key to preventing long-term complications. By recognizing these symptoms and working closely with a certified healthcare provider, you can regain balance and enjoy better overall health. Thank you so much for watching today's episode. Don't forget to like, share, and subscribe for more informative content. Until next time, take care of yourselves and sweet dreams.